Let me just tell you a little bit about Montana Healthcare Foundation. We were created at the end of 2013 as a result of the sale of Blue Cross and Blue Shield of Montana. We have no relationship to Blue Cross and Blue Shield anymore. We're an independent private foundation. Our purpose is to make strategic investments that improve the health and well-being of all Montanans. We focus on at-risk populations and health disparities in particular. We are the largest Montana-based foundation that focuses only on health. And again, we're an independent private 501c3 foundation. And we are formed, importantly, for I think all of you on the call that might be interested in applying for grants, this is not your last opportunity. We're a permanent resource for Montana. We manage our trust investments sustainably and intend to make grants and grant-related investments of about 5% of the value of our trust each year. We have three major focus areas, and we do some work in other areas as well, but for the purposes of this call for proposals, these are the three areas that we'll be funding in. The first is American Indian health. The second is behavioral health, which is a term we use to encompass mental illness and substance use disorders. And within that behavioral health focus, we have two more structured initiatives that we're going to be emphasizing a lot this year. That's integrated behavioral health, which we'll tell you a little bit more about, and also strengthening the substance use disorder prevention and treatment system in the state. Finally, we have a broader focus area called Partnerships for Better Health, and we'll explain what that means in just a few minutes. So just an overview of what's happening with this 2017 call for proposals. We expect to invest more than $5 million in charitable activities in 2017. A good chunk of that will come through this call for proposals, but we'll also be investing some of those funds through invited grants and other more structured initiatives. We'll give out two types of grants under this CFP. The first is what's called a rapid response grant. That's a one-step application process that will offer 2 times and possibly a third in 2017. The grant amounts are between $10,000 and $75,000. They'll fund 1 to 2 year projects. And generally, we think of these as either planning grants, so planning a larger project that you'd implement sometime after the grant, or an implementation grant for a smaller project. And then we have our large grant initiative. This is a 2-step application process that's offered 1 time this year. That opportunity is currently open to submit a letter of interest, or what we call a brief proposal, where you outline the basics of your idea. And then we'll, again, in the second step, we select the strongest of those brief proposals and invite them to submit a more detailed full proposal later in the year. Those grants will be between $75,000 and $150,000. They'll again fund 1 to 2 year projects. And we think of these as being more grants that would support implementation of something that you may have already developed a strong business plan for. And again, we'll go over the selection criteria, but when we give out those large grants, we're really looking to fund activities where there's a very clear plan for how you would sustain the project after our grant is over. One organization can submit up to 2 different proposals. It could be 1 rapid response and 1 large grant, for example. These are our basic eligibility criteria. So if you want to apply, you need to be a Montana-based organization that is either a 501c3, except we don't fund private foundations, and getting technical, a type 3 non-integrated supporting organization, which is defined in section 509A of the Internal Revenue Code. We fund tax-exempt educational institutions, and we fund state, tribal, or local government agencies. And just a note, if you're intending to apply in the American Indian health focus area, tribal government agencies and American Indian-led nonprofits are the eligible entities. You can, if you're eligible to apply for the grant, you can use part of your budget for a contract with an entity that might not be otherwise eligible. So, for example, if you wanted to contract with an out-of-state organization to do part of the work on your project, that is acceptable. But but to be eligible to apply, you have to meet these eligibility criteria. This is just a quick summary of our selection criteria. We really urge people to read these because there's detailed descriptions of each one in the call for proposals, and this is the lens that we use to evaluate each and every grant proposal that we receive. We look first at the importance of the health issue to be addressed and how you've explained why this is the issue that you've decided to focus on. We look at the need for the project, and in determining need, we look at both, where the project is, how well served the area is already, whether there are other projects that address the issue you're hoping to focus on or not. We do strive to have a geographically diverse portfolio of projects so that we're not just funding in the larger communities, but funding all over the state. We look hard at sustainability, especially for our larger grants, but for all of our grants, we really focus on funding projects that are not going to be grant dependent forever after. And because we're working in healthcare, we also focus strongly on thinking about business planning. If you're providing a healthcare service, is there a way that after the startup period is done that we've helped fund, will you be able to bill for those services? Or if you're improving health outcomes, are you actually generating savings for the health system that could in some way be recouped through, for example, shared savings agreements with a payer or with the hospital system? We focus on creating new partnerships. When you answer the partnerships question in our proposal, I strongly advise you to really think about what this grant would do to create new partnerships with organizations you may not have worked with before, or to strengthen existing partnerships in specific ways. We're not interested in generic letters of support from people that you have existing partnerships with. We're really interested in using these grants to help communities have systems that work better and more efficiently and effectively together. We have a strong focus, as I mentioned at the start, on at-risk populations and health disparities. So using our resources to bolster care and improve outcomes for populations that have particularly high rates of illness, disparately, high mental illness or other health problems, for example. We want to understand whether the project that you have in mind has some evidence that it should work. So when we say solutions exist, we're looking at whether it's an evidence-based project that you're proposing, whether there's reason to believe it would work in the particular community in which your project would be operating, whether it's workable in Montana and culturally appropriate. We also look at feasibility and scale. Is this something that can be implemented, practically speaking, in your community? And if it's successful, could it be scaled to other communities in the state? Could we use this as a pilot project that might point the way for other communities to address a common and important health problem? Again, I mentioned that we want to see contributions to a diverse grantee portfolio. We want projects to be relying where it's possible on established best practices. And if you apply for funding and you're not a tribal government or a tribally controlled nonprofit, but a big part of your project would involve working on a tribal health issue, we need to see very strong collaboration with tribal leadership. So this is a list of things that we don't fund. We don't provide grants to individuals. We only provide grants to the eligible entities that we went over a couple slides ago. We don't fund capital campaigns or fundraising events. We don't provide funding for operating deficits or retirement of debt. We are not currently funding construction projects or real estate acquisitions or major capital projects. That could change in the future. We have our eyes on how we might contribute to selected projects in that arena sometime in the future, but for this year, we have not made any changes. We don't generally provide funding for fundraising events. We do not fund any type of discrimination. We cannot fund lobbying as defined by the U.S. Internal Revenue Code, and that's something that's very important for grantees to understand what the code says and what lobbying is, and to make sure that the projects that we would be funding or the activities we're funding do not constitute lobbying. We don't fund activities that support political candidates or voter registration drives, again, as defined in the Internal Revenue Code. We don't generally fund large equipment purchases. This is one we always get questions on, so I do want to be clear. You can include equipment purchases in a grant budget. It just can't be the major purchase, the major part of the budget or the major reason that you're applying for a grant. We don't fund medical research or research that lacks a direct, targeted, and practical benefit to Montanans' health. The projects we fund need to have a reasonable probability of improving the health of the community or communities that you're serving within the time period of the grant or shortly thereafter. We don't fund organizations or foundations that would use the grant to redistribute the funds via subgrants. I want to call attention to one specific requirement that we have through Montana state law, and there's guidance on this that's available as the link on this slide. So according to state law, we can't use our funds to supplant government funding. So what does that mean? If you look at the definition of supplant, it means to supersede or replace. So if you have government funding for an activity, you can't use Montana Healthcare Foundations to replace those funds. You can use them to supplement or augment the funds that you have. So for example, if you have government funding for something, but you want to add new specific outcomes or deliverables that couldn't be accomplished with your current government funding alone, you can use Montana Healthcare Foundation grant funds to do that. So I'm going to start going over our focus areas in a little bit more depth. We'll start with the American Indian Health focus. So we've spent a lot of time working with tribes, urban Indian health centers, and other stakeholders in Indian country and Montana to understand what the needs are. Some of the examples of key challenges we've identified through those conversations over the last few years include inadequate funding for health services and disease prevention activities, and this is long-standing. The need for technical assistance that would strengthen tribal organizations' ability to code and bill and administer health services so that they can build strong tribally run health services. A limited availability of treatment for substance use disorders. The many challenges that face young families, including historical trauma and a lack of economic opportunity and adverse childhood experiences that are very prevalent. Suicide and mental illness. Oral health challenges, and including limited access to care and fairly prevalent dental problems in some communities, and many other health disparities. So for example, specific illnesses like diabetes. Some examples of projects that we are funding and will focus on funding again in this grant cycle. Strengthening the funding and administration of health services and prevention programs by tribes and urban Indian health centers. Tribal self-determination, so that's using Public Law 638 to contract or compact for specific Indian health services, Indian health services. Strategic planning efforts to decide where you want to take your health system and how to get there. Programs that would address the problem of drug use in pregnancy. And this is a major focus across the state, not only in the American Indian health portfolio. We'll talk a little bit more about that later under behavioral health. Injury prevention programs, especially those that have a strong path toward becoming self-sustaining after our grant. Addressing the health and health service needs of urban Indians, and leadership development activities. So I'm going to turn this over to Scott Malloy, our Senior Program Officer in Behavioral Health, to talk a little bit about the next focus area.
Thanks, Aaron. So the list here is by no means an exhaustive list, so we're kind of going over some highlights. So I really encourage folks to review the CFP and the summaries of the behavioral health programs and challenges that we've outlined. And we do know three of the significant challenges are, limited access to treatment for mental health and substance use, for prevention and treatment. And we also know there continues to be high rates of behavioral health individuals with behavioral health entering the criminal justice system along the continuum, whether that be law enforcement, local corrections, or Department of Corrections. There continues to be challenges within communities that we hear about with individuals that have mental health, substance use, or co-occurring issues, and perhaps chronic medical illnesses, trying to navigate the systems in the communities and have the organizations provide the best care possible. So for this year, we have two specific initiatives that we'll review. One is a continuation of the work in integrated behavioral health, and we're highlighting a new and increased focus on strengthening the substance use disorder prevention and treatment system. And then again, want to remind everyone that there is many other behavioral health challenges that we are aware of, and this is not specifically limited to these ones that we're reviewing today. So challenges in the criminal justice system, and also the ability to strengthen the regional continuum of care for both mental illness and substance use are some other examples. So for our integrated behavioral health initiative, so this is the second year of this initiative. So we're continuing the two opportunities to have a planning grant and an implementation grant. So we define integrated behavioral health as a team-based approach that integrates primary care, mental health, and/or substance use to improve the overall health of the individual. And so the planning grants for this year will be increased from $35,000 to the available funds of $50,000. And so the structure of this will be the same, where a consultant will work with all of the planning grantees and have a cohort of learning communities, webinars, and individually focused training and technical assistance. The implementation grants this year, we are changing this to bring it out of the open call for proposals and do this by invitation only. So if anyone is interested in the implementation grants, you can contact our office and we can visit about your project or your proposal, and we'll do that through an invitation only. So an increased focus for us this year is, again, the strengthening the substance use disorder prevention and treatment system. So we really look at this substance use disorders as really a new way and an emerging way of looking at how substance use is really viewed. And so it's similar to mental illness, how it's viewed as a chronic medical condition. Substance use disorders are really best treated through a team-based approach and coordination of care and tracking outcomes. So we really want to look at things through that lens. And again, the list of the priorities that I'm about to go over is by no means an exhaustive list of what would be considered under this initiative, but it's I think a highlight of the significant priorities. So as Aaron mentioned, drug use in pregnancy is continuing to emerge as a major challenge across communities in the state, and we want to prioritize organizations and communities to target drug use in pregnancy. Medication-assisted treatment, again, the initiation, access, or enhancement of this valuable service on a continuum is very important. Emphasizing, again, medication-assisted treatment as part of integrated behavioral health setting. And also, there's been major changes afoot as substance use providers know in 2016 with Medicaid expansion, and also many unknowns moving forward. And there's opportunities for certain organizations to provide SUD as substance use disorder treatment as part of their scope of care. And we really want to call that out as a priority to assist organizations to do that. And as Aaron mentioned too, a big focus of everything we do is partnerships. So if you're providing substance use, mental health, or primary care, and you want to provide, for example, primary care providing mental health or mental health providing SUD, anything that can strengthen the partnerships in a community, either through new partnerships or enhanced partnerships, is a huge priority. SBIRT, which is screening, prevention, screening, brief intervention, and referral to treatment. This has been around for quite a while, and there are some places that are doing this, but what we continually hear is it's being implemented scarcely in some places, and in others it could be enhanced. So we really want to call that out as a priority as well. And again, as mentioned, the substance use providers have had major changes this past year, and moving forward, there's some unknowns as far as the healthcare reimbursement for substance use, and business development and any revenue cycle support is called out as a priority as well. Then again, the idea of prevention, communities and regions really establishing a framework by which prevention can be delivered or prevention can be viewed. And so we're not talking about funding prevention services here. We're really talking about creating frameworks by which substance use prevention can really be viewed from and kind of catalyze resources within that community or region.
Great, thank you very much, Scott. So on our last focus area, what we call partnerships for better health. So this is really focused on what's also commonly called these days value-based care. The challenges that we run into all the time are the limited access to health services in rural areas, the workforce challenges that we face across the state, particularly in rural communities, funding challenges, the low reimbursement, for example, for mental health and substance use treatment, which makes it hard for providers of those services sometimes to make a go of it, especially if you're in a remote area. Rising healthcare costs, of course, continue to be a challenge. People who are often referred to as high utilizers, who are often people that have a complex mix of behavioral and physical illnesses that end up requiring frequent ER or hospital care without necessarily really getting the improvement in outcomes that you would hope for from all of those expensive services. And then health disparities and the influence that the social determinants of health have on health outcomes, regardless of how good the healthcare system may be. So the challenges, for example, of improving health against the current of poverty or poor housing or poor education or what have you. These are broad challenges. We are focused a little more narrowly in terms of what we'll fund in this portfolio. We focus on interventions that we think will generate value in the healthcare system. That is, interventions that have a real good reason to believe that they'll improve health outcomes in a demonstrable way and at the same time save money. So for example, community health teams and other approaches to care coordination, case management, and community outreach. Using that sort of an approach to identify and improve outcomes among the high utilizers. School-based health centers also seem to be a very promising intervention, one that we've had some great experience with in our first couple of waves of grants and that we're very hopeful about in the future. Interventions that address upstream risk factors for health and health disparities and the social determinants of health. And then direct collaboration among community agencies to address a major health issue. So again, thinking about whether there might be a way to form a new relationship, for example, between a public health department and a mental health center, or a health department and a hospital to address a key health issue and use resources more effectively and more efficiently. Then oral health is another issue that's often left off these lists, but which has profound health implications as well as social implications for children, for example, who have a lot of dental problems, miss a ton of school, and that has repercussions throughout the life course. So oral health is another area where we feel like there's a lot of potential to generate value through better health systems. So we're going to turn the corner now from what we fund to telling you a little bit about how to apply, and I'll turn it over to Ted Madden, our Chief Operating Officer.
Great, thank you, Aaron. So the system we're using is very similar to last year. So if you're an existing user, you'll see not too many changes. The best way to access the system is through our website at mthcf.org. In the upper left, you'll see a grants login button. Just one caution for new users: before you set up a new user account, please check with your organization to see if there is an existing account. That usually universities or hospital systems have a grant coordination effort that someone will be applying through there. So if not, just you can always check with us to see if you have an account set up with our grants management system. Otherwise, you can establish a new user account on that landing page with the grants login system. The main thing here is to, if you do have questions about how to use the system, you can contact Kayla Talbert at 451-7060. Otherwise, the instructions are pretty laid out of new users and returning users how to sign up. The apply page, this is where you'll see many applications that are on our website or on the open call right now. And so this is where you should really focus on which one you want to be, what area of focus you'll be in applying under. And as you get in the application, all the applications are a little different. There's 5 main areas of each application. The rapid response would be a 1-step process. The large grant will be a 2-step process where you'll do a brief proposal, and then if you're invited later in the spring, you'll be asked to submit a full proposal. But the main areas would be your eligibility and organization information, demographic and who you'll be serving, the project title and summary, project proposal, which will include work plans and outcome measurements, and then the project budget. Project budget will include how you intend to use Montana Healthcare Foundation funds, other potential funding sources for the project, both in hand and that you're applying for, and keep a status of those opportunities. And then a detailed budget will be required for the rapid response grant, and if invited, for the full proposal. And you will receive a confirmation of your submission from grants management. It won't say Bondant, which is our company, the company that runs the application, but it'll say grantadministrator.com will be the confirmation. So you should receive that. If you're not, you can contact us and see if your grant's been submitted or not.
Okay, thanks, Ted. So just a couple more details on the call for proposals. The call for both the rapid response grants and the large grants is open now. For the rapid response grants, the first round proposals are due on February 14th, and we'll be aiming to make funding decisions by about March 24th. For round 2 of the rapid response grants, the call for proposals will open on May 1st. Proposals will be due on June 5th, and we'll be aiming to make funding decisions on July 21st. We'll be deciding sometime after July whether to offer a 3rd round of funding under rapid response, and if we do, we'd anticipate that would open on September 1st, with proposals being due in October and a funding decision later in November. For the large grants, the call is open, as I said. Brief proposals are due on April 7th, so you've got lots of time to think about your project and start planning. Full proposals will be invited on May 22nd for those who submitted a really strong brief proposal. We usually weed out somewhere in the neighborhood of half to 2/3 of the proposals we receive at that brief proposal stage, because we don't want too many people doing the work of a full proposal. If they're less likely to receive funding. Then the full proposals would be due on August 4th, and we'll be aiming to make funding decisions in October with an anticipated start date of November. So we're going to go ahead and start the Q&A session. So just a reminder, there's a Q&A button which you can press. You type in your question. We ask that people try to avoid asking very specific questions about your project idea. Instead, try to frame questions in a way that might apply to others who are on the call. We're always happy to try to talk or email one-on-one if you have a more specific question. But I think, go ahead and ask us anything you have today, and we'll do our best to get to all of the questions you have. If you don't have the chance to ask a question today, or if we don't respond to it fully during the presentation, please email it to us, and we'll do our very best to respond as quickly as we can. And I do want to emphasize that we are a staff of 5, so we're pretty small, but we do really our very best to be as responsive as possible to every individual applicant that has questions. We're open to questions. There's no such thing as a silly question, and we hope you'll feel free to ask us any questions that you have. And we will be posting this presentation and the Q&A session in a recording on our website. And answering any questions that you've submitted that we don't get to by the end of the hour. So with that, I think we've got a few questions already, and please keep submitting them. We'll do our best to get to all of these.
All right, so our first question is, are Montana-based chapters of national organizations eligible?
Okay, so this is one that we've received a few times before, and I want to also point you toward our frequently asked questions on the website, and I'll actually read from one of those to answer this. But under the eligibility section of the FAQs on the website, we have a question titled, what does Montana-based organization mean? So what we mean are that it's organized, incorporated, and has offices in Montana. Independent C3s that are Montana-based and are controlled by a Montana board, but may be part of a chain of related nonprofits nationally, are eligible to apply. But there's a lot of nuances there that we found over the last couple of years. So if this question doesn't provide a specific enough answer, email us, and we will go over your specific organization and that question.
Great. Our next question is, for strategic planning and development of organizational focus or infrastructure, does MHCF have recommended providers or consultants?
So we do not have specific people that we would ask an applicant to work with. We, depending on the type of strategic planning and organizational development that you're interested in, we may have some people that we've either worked with or that some of our partners or grantees have worked with, and would be happy to go over those with you more on a one-by-one basis. But we don't have any specific list or requirement for you to go with someone that we know. We're also happy to help you identify them. I think that is one of the challenges, is finding somebody with just the right set of expertise to help you with something you have in mind. So we're always happy to talk that through with you.
All right, the next question is, the webinar indicated we can only apply if it's a new project. However, the RFP indicates that the rapid response grant can be used to enhance an existing project or design a new project.
So thank you for the question. I'm glad that you read the call for proposals. Yeah, you're absolutely right. And the call for proposals is correct. We summarize the call in this brief webinar, but that's an important nuance. You certainly can use a rapid response grant to enhance an existing project or to plan or design a new project.
Our next question is, what is a diverse grantee portfolio, or what do we mean by that?
We seek to fund a range of organizations, so different types of organizations, not just hospitals, not just health departments, not only universities, but a range of different types of organizations across a diverse range of diverse geography around the state. In other words, we want to have grants throughout the state, not just focused in certain areas. There's often a tendency for larger organizations to have more capacity to even plan and submit grant applications for a new project. So we want to make sure that we're also facilitating grant applications by smaller organizations that may not necessarily have the time or internal capacity to even think about a grant application, but who may nevertheless have tremendous need and have a great idea floating around out there. So we do a lot of work to make sure that we're funding the diverse range of organizations and grants and communities all over the state.
What are the differences, if any, between rapid response proposals round 1 and 2? Is there more funding available in round 1?
There are no planned differences. So the focus areas will be the same, the grant size will be the same. It's really just a chance to if people don't apply earlier in the year and then an opportunity or an idea comes up later in the year, that there will be another chance to apply.
Are community colleges eligible?
Yes, provided they're nonprofits.
Our next question is it allowed for an organization that is in the midst of a 2-year grant to apply for another grant for a different program, as long as the organization is doing a good job with the current grant and in current reporting?
Absolutely. This is also addressed in the FAQs, so just to point people toward that resource, but this is a very good question, comes up a lot. If you have a current grant, you can apply again. To be considered for your application, you'd need to be current on all your grant reporting. You'd need to demonstrate that you're making adequate progress on your current project, but you certainly can apply again.
Our next question is, I have a project idea that I feel fits with the grant priority areas. However, colleagues have mentioned that MHCS is probably not interested in funding in this area. Is there someone I can speak with about my specific project idea to see if it's worth applying?
Absolutely. You can always, give us a call or email to talk about the specific idea. And we do our best to make impartial decisions based on our funding priorities and selection criteria. Certainly not based on biases. So I would hope that I'd hope we'd be able to explain, our thoughts on the proposal in terms of the selection criteria. We don't give applicants sort of a foreshadowing of how we're going to decide on their proposal. We've just found it's almost impossible to know, will we fund it or will we not, until we have the full proposal and all of your thinking about what you would do in hand. But we can certainly talk with you about the specific topic and how it does or doesn't fit within our priorities and selection criteria.
Do rejected proposals get feedback for the opportunity to improve future chances?
We do offer feedback. We don't provide it routinely on every grant application that's turned down, but when applicants request, we do our very best to give as much feedback as we can. We really value that interaction, and as long as staffing permits and there aren't hundreds and hundreds of requests to respond to, we'll be happy to do that.
Do you support collaborative rural EMS efforts?
So that's a specific project topic and probably best to kind of go over with you according to our selection criteria. I think I'd encourage you to read over the CFP and the selection criteria, and then if it's still not clear, either just submit a proposal or email the info@mthcf.org and ask if you could have a few minutes with one of us. Scott or Ted, anything to add on that?
Okay, I didn't see anything pertaining to the evaluation piece. Do you require an independent or external evaluator?
Thank you for asking that. We actually just posted a little bit of guidance on our website about our philosophy and approach to evaluation. We ask every grantee, whether it's a $10,000 grant or a $150,000 grant, to include an evaluation component and to plan that when you submit your proposal. So there will be a question on how you would evaluate your project, what outcomes you're aiming for. But we don't feel that it's worthwhile to conduct a formal external evaluation on every grant project. We would leave it to you as the applicant to decide, is this something we can do ourselves? Is this something we need help with and would include that in our budget? And honestly, most grantees aren't commissioning external evaluations. We occasionally may, if a project, particularly in the case when a project appears successful and maybe broadly applicable to other communities in the state, we might approach you and suggest, what if we hire an external evaluator to sort of validate the results you're getting and help tell the story of what you're achieving. But we certainly don't require you to include an external evaluation in every project.
Are the focuses for health limited to these areas only? Oral health is great. Would vision be an option too?
So, and before I answer that one, let me just go back to the evaluation question. Melinda, maybe if we send out a follow-up email, we could send a link to that evaluation discussion. Great. Yeah. So Vision would, could, as long as the project you have in mind is responsive to the selection criteria that we've outlined, absolutely, that could be an area that we would fund. Again, the examples that we gave you under each focus area, sort of particular high priority areas we've identified, those aren't meant to be the only areas that we encourage you to apply in. If there's another topic that you feel is a particular priority in the community you serve, then you should articulate why, and again, just read through the selection criteria and think about how you would answer each one of those with regard to vision or any other topic that might not have been on the list in this webinar.
Can we submit a proposal for each round of rapid response?
You can. Just bear in mind that we try to limit it to 2 proposals per organization in 2017.
Would alternative healing practices be considered, for example, a native Indian health, for funding?
Absolutely. When we say evidence-based and best practices, we include the need to make sure that practices are culturally adapted and meet the needs of the specific community that you serve. We aren't asking you to submit randomized controlled trials necessarily, but we are asking you to make a cogent argument as to why you feel that the practice that you want support for is the most effective way to serve the needs and the health issue that you want to address.
Our next question is, when will the PowerPoint slides of this presentation be available? And I can go ahead and answer that. We'll be sending out an email after the meeting, hopefully later this afternoon or tomorrow morning at the latest. And then we're also going to post the slides and the recording onto our website. That should be up tomorrow morning.
These are great questions, so keep them coming.
Our next question is, a MHCs consultant was mentioned in regards to rapid response grant recipients. Can you say a little more about what that relationship would look like if the nonprofit is intending to implement a smaller project?
Let's see. I think, I'll try to answer that, and please just, type in a clarification if we aren't answering correctly. The consultant that I think we may have mentioned is the consultant that works with us on integrated behavioral health. We work with the National Council on Behavioral Health, which provides technical assistance to all of our grantees, both planning and implementation grantees on behavioral health. And that typically includes an in-person training and then cohort-based webinars and resources for any practice that's interested in planning or implementing integrated behavioral health services. Is that anything else, Scott? So that I hope that's the consultant that you're referring to. If not, just go ahead and type a little more detail for us.
Our next question is, can granted funds be used to help pay for for-profit contractors, for example, research outcomes and evaluation consultants?
Yes, absolutely. You have to be eligible, and that means that you've got to be a nonprofit or a government entity. But if you have a consultant that's for-profit, that's perfectly legitimate use of part of your budget. We look askance a little bit at a grant proposal that appears to be purely a pass-through to a non-eligible entity. So the grantee itself, or the applicant or organization that is eligible, should have substantial involvement in the project. If you apply for a $150,000 grant and 149 of it's going to a for-profit out-of-state non-eligible entity, we're probably going to question that. But otherwise, no limits on who you choose to use as a consultant.
Can you speak a little more in depth regarding MHCF's position on poverty, specifically housing, permanency for children specifically if you can, and upstream, downstream implications?
We are doing quite a bit of work on housing. Over the last couple of years, we've funded several grants that attempt to form stronger partnerships between the housing and healthcare communities. Nationally, there's a great deal of evidence that providing stable housing and supportive housing and the housing first approaches for people living in poverty or people that are the homeless population, improve health outcomes, and indeed also reduce healthcare costs. So for, one of the examples I love to cite is the New York Medicaid, in redesigning the Medicaid program, decided to spend a huge amount of state Medicaid dollars on providing permanent supportive housing for the homeless, high-utilizing population that was found to be costing state Medicaid a ton of money. The types of interventions that we fund in the poverty and housing arena are going to be those that really build a strong partnership with the healthcare system, track health outcomes as a result of the intervention in housing, and ideally develop a path towards sustainability through repurposing healthcare dollars that may be being spent ineffectively, for example, on repeat ER visits or hospitalizations for a homeless patient, by deploying a more effective intervention like permanent supportive housing for that person.
Can I put a plug in here as well for our website and the resources on there in terms of a grantee map of current projects that are happening in the state that we've funded, but more importantly, some of the other initiatives that may not result in a grant through this application, but other conversations and initiatives that are happening around housing, around other healthcare issues in the state. So we do write grant, or we do offer grants, but we also offer some other convening and other research resources on our website. And so we are interested in your feedback about housing projects that are happening in the state that we want to know about. So a little plug there for our website as a resource as well.
Would a rapid response grant be available to an individual or an organization that hasn't achieved 501c3 status to aid in the setup of a nonprofit American Indian organization?
So the strict answer is, under this call for proposals, no. The eligibility criteria would preclude that. We do a lot of work with tribes and with small nonprofits and small communities around the state, some of whom are not eligible to apply for a grant fund. We're always happy to try to arrange a one-on-one conversation with you to understand the type of organization that you're trying to build and see if we can't identify some sort of resource that might be helpful to you. But within this call for proposals, we would need to stick with those eligibility criteria.
Would telemedicine partnerships be considered, in particular behavioral health? It seems in rural areas there are limited providers.
Yeah, so again, not to comment on a specific project or proposal for telemedicine, but clearly in Montana, if you're not talking about telehealth in rural areas, you're going to have a really difficult time actually providing care within your communities, as you all know. So we would anticipate, especially in the rural areas, that telehealth for behavioral health and for other health issues is going to be part of what communities are already doing or will do.
All right, our next question is, are the chances for a CAH getting a grant better if we find a large tertiary center to partner with?
So, and just assuming that CAH is critical access hospital. So to answer that question, I would basically say the simple answer is no, they wouldn't be any better or worse. The real way to answer the question is to think about the project that you want to do and whether there is a reason that you need that large tertiary care center. So if you think through our selection criteria on the sort of the feasibility and design of your project, are you going to be able to better achieve your goals if you have a partnership with that tertiary care center, or do you feel you can do the project without that partnership? We don't have any specific selection criterion that would say don't fund critical access hospitals without a tertiary care center partnership. We actually provide lots of funding to hospitals around the state, and many of them do not have that sort of affiliation. So either way would be okay.
Our next question is, does MHCF offer links to data resources, as Aaron and Ted mentioned, or findings to date from grantees? Do you know of any Montana-specific databases? Montana-specific database information systems for providing statistically valid information in grantee requests?
Okay, so the data resources that we use, and I'll ask Ted and Scott to weigh in here too. We are probably in the same boat as you, when you're trying to understand the health needs of a community. We piece together resources everywhere we can find them. So we don't have a detailed database on our website, but we do rely on state health data from the Department of Health and Human Services. We rely on community health needs assessments that are done by critical access hospitals and larger hospitals around the state. We rely on the community health assessments that many local health departments are doing. And we pull data from anywhere else that we can find it. We're always happy also to talk with individuals about a specific data challenge you may have, because we have done a fair amount of work through our funding and our partnerships with the state and tribal health departments to try to identify better sources of data. It's always a challenge in rural states, and Montana is no different. So if that question didn't help enough, we're happy again to talk one-on-one.
That's all I have. Does anyone have any other questions?
Keep them coming. Well, actually, we've only got another minute, but please do fire away while you've got us. Okay, well, we're not seeing any more. So I do want to thank all of you for getting on the line with us and for your patience with the obligatory technical problem at the beginning. We'll figure it out one day. If you have more questions for us, please don't hesitate to be in contact at the info@mthcf.org email address. We welcome all of your questions. We hope you'll be in touch, and we hope you'll all apply. Thanks so much.